Hi, this is Dr. Arun Vishnar, and in this particular short lecture, I will be talking about acute non-toxic megacolon. Now, this particular acute non-toxic megacolon is entity in which the right colon, I will show you in the figure here that in this particular figure you can see in this photograph here, this is right side of the colon, this particular part. This is right colon, also known as ascending colon. This is large intestine, ascending colon. This is transverse colon, and then the descending colon and sigmoid colon, and then rectum. Now this particular disorder, which is known as acute non-toxic colon, also known as Ogilvie's syndrome. In this particular disorder, what happens? This particular part of colon from cecum up to this end, that is hepatic flexure of colon, is this one, the hepatic flexure of colon, and this particular part, this gets dilated. Whole of this segment gets dilated, and sometimes it proceeds up to the transverse colon. So this particular part of colon is dilated, which we call toxic megacolon, non-toxic megacolon. This particular non-toxic megacolon is usually seen after recent surgery, if there is some abdominal surgery or surgery of any part of body, after general anesthesia, after certain medications like antihypertensive drugs, anti-diabetic drugs, anti-arrhythmic drugs, drugs which are used for depression, drugs which are used for anxiety. In this particular, whenever patient is on this particular drug, this particular disorder may get precipitated. So this acute non-toxic megacolon, this is an exclusion diagnosis. First, you will have to exclude all other causes of intestinal obstruction, distal intestinal obstruction. All the causes, when you have ruled out all these causes and still this colon, this particular part of large intestine is dilated, we call it acute non-toxic megacolon. Sometimes when the myenteric plexus, that is the network of nerves of this particular segment, is invaded by tumor, then also such this type of megacolon occurs, this non-toxic type of megacolon. So this is an exclusion diagnosis. Any disorder which is obstructing this colon should be ruled out. This type of non-toxic megacolon is also seen in chronic obstructive lung disease due to congestion of the GI tract. It is also seen in some neurological disorders after hip fracture. So these are the usual causes of this non-toxic megacolon. In this non-toxic megacolon, patient will complain of distension in right flank. In the right flank, there is distension, there is fullness of the right flank, there is discomfort in the right flank. Then patient will complain of not passing not passing gas through the whenever there is such type of non-toxic colon. He will complain of dull aching type of pain in this particular region on the right side because of this non-toxic colon. So whenever a patient presents with such types of symptoms, first you should rule out the that there is any obstruction in the distal region of the intestine. Once you have ruled out obstruction in the distal region, then you will label it as non-toxic colon, acute. Now what happens in non-toxic colon, acute non-toxic colon, in this particular region, this particular region is known as cecum. The cecum gets distended and sometimes there is perforation in this region. So it becomes an emergency. Whenever this size of this cecum is, it becomes greater than 12 centimeters, then there is chance of perforation. So whenever a patient comes with such type of acute non-toxic colon, such patients should be thoroughly investigated and proper radiogram should be obtained. X-ray of the abdomen should be obtained after 6 hours, 6 hourly basis, so that if there is any progression, it can be ruled out. In these patients, we usually treat these patients by keeping them nil orally. RT is inserted, Ryle's tube, and whatever secretion which is present in the abdomen, that is removed. If there is any electrolyte imbalance, then that is corrected, and patient is kept nil orally for 2 to 3 days, and usually this condition reverts back to normal. Now, this particular short lecture which I have given on this acute non-toxic megacolon, which is also known as Ockley-Levis syndrome, this particular lecture will be helpful to medical students, for those who are doing post-graduation, for gastroenterologists, and students who are appearing for postgraduate entrance examination. So if they go through this type of lecture, then it will be helpful to them. Thank you.